Ouch! That sudden, intense joint pain can be debilitating. Is it gout or pseudogout? These two types of arthritis often get confused because both involve painful crystal deposits in the joints. However, the types of crystals and underlying causes differ, leading to variations in treatment. Understanding these differences is crucial for proper diagnosis and management. This essay will guide you through the intricacies of gout and pseudogout, equipping you with the knowledge to differentiate between these two common conditions. Let's delve into the world of crystals and joints. Both gout and pseudogout announce their presence with sudden, severe joint pain, redness, and swelling. The pain can be excruciating, making it difficult to move the affected joint. Gout typically affects one joint at a time, most commonly the big toe. Pseudogout often targets larger joints like the knees or wrists. The root cause lies in the type of crystals that accumulate in the joints. Gout arises from uric acid crystals, a waste product of purine metabolism. Pseudogout is caused by calcium pyrophosphate crystals depositing in the joints. Diagnosing gout and pseudogout based on symptoms alone can be tricky. Synovial fluid analysis provides the definitive answer. A doctor extracts synovial fluid from the joint. Under a microscope, the culprit crystals reveal themselves. Uric acid crystals in gout look like tiny needles. Calcium pyrophosphate crystals in pseudogout are rhomboid-shaped. Both conditions affect various joints but favor specific locations. Gout often targets the big toe, known as podagra. It also affects ankles, knees, and smaller joints. Pseudogout prefers larger joints, especially knees. Wrists, ankles, elbows, and shoulders are also common. Knowing these patterns aids in early suspicion and attention. Remember, these are common patterns and exceptions can occur. Section 5. X-ray vision spotting pseudogout. X-rays, while not the primary diagnostic tool, can provide valuable clues, particularly in cases of pseudogout. In gout, X-ray findings are often normal in the early stages but may reveal joint damage with repeated attacks. Pseudogout, on the other hand, often showcases a characteristic radiographic feature called chondrocalcinosis. Chondrocalcinosis appears as fine linear calcium deposits in the cartilage of affected joints, giving the cartilage a denser appearance on X-rays. This finding can help differentiate pseudogout from other forms of arthritis and support the diagnosis. Section 6. Who's at risk? Both gout and pseudogout share some common risk factors, but certain factors tip the scales toward one condition or the other. Gout predominantly affects men and postmenopausal women, with the risk increasing with age. Obesity, excessive alcohol consumption, a diet rich in purine-rich foods like red meat and shellfish, and a family history of gout are all contributing factors. Pseudogout also becomes more common with age, affecting both genders equally. Previous joint injury, certain metabolic conditions like hypothyroidism and hemochromatosis, and a family history of pseudogout can increase susceptibility. Section 7. Remember this. To remember the key difference between gout and pseudogout, here's a simple mnemonic. Gout is for the great toe. This reminds us that gout commonly affects the big toe, while pseudogout typically targets larger joints. This mnemonic is a handy tool to keep these two conditions straight, but remember, it's just a memory aid. Always consult with a healthcare professional for accurate diagnosis and treatment. Section 8. Test your knowledge. Think you've grasped the differences between gout and pseudogout? Let's test your knowledge with a quick quiz question. Which of these conditions is more likely to be diagnosed based on the presence of chondrocalcinosis on an X-ray? Is it A, gout, or B, pseudogout? The answer is B, pseudogout.